ਬਰੈਂਪਟਨ ਸੈਂਟਰ ਤੋਂ ਐਮਪੀਪੀ ਸਾਰਾ ਸਿੰਘ ਨੇ ਮੁੱਦਾ ਚੁੱਕਿਆ ਕਿ ਜ਼ਰੂਰੀ ਸੇਵਾਵਾਂ ਵਿੱਚ ਕੰਮ ਕਰਨ ਵਾਲੇ ਲੋਕ ਲਗਾਤਾਰ ਕੋਵਿਡ-19 ਨਾਲ ਪ੍ਰਭਾਵਿਤ ਹੋ ਰਹੇ ਨੇ, ਪਰ ਸਰਕਾਰ ਇਸ ਸੰਬੰਧੀ ਕੁਝ ਨਹੀਂ ਕਰ ਰਹੀ। ਇਹ ਕਾਰਨ ਹੈ ਕਿ ਪੀਲ ਰੀਜਨ ਕੋਵਿਡ-19 ਨਾਲ ਜੂਝ ਰਿਹਾ ਹੈ। ਸਿਹਤ ਮੰਤਰੀ ਕ੍ਰਿਸਟੀਨ ਇਲੀਅਟ ਨੇ ਦੱਸਿਆ ਕਿ ਸਰਕਾਰ ਨੇ ਟੈਸਟਿੰਗ ਲੋਕੇਸ਼ਨਾਂ ਵਿੱਚ ਵਾਧਾ ਕੀਤਾ ਹੈ ਅਤੇ ਹਸਪਤਾਲ ਵਿੱਚ ਬੈੱਡਾਂ ਦੀ ਸਮਰੱਥਾ ਵਧਾਉਣ ਲਈ ਫੰਡ ਵੀ ਜਾਰੀ ਕੀਤੇ ਨੇ। ਸਾਰਾ ਸਿੰਘ ਨੇ ਪੇਡ ਸਿਕ ਲੀਵ ਦਾ ਮੁੱਦਾ ਵੀ ਇਸ ਮੌਕੇ ਚੁੱਕਿਆ।
Yesterday, the Premier insisted that his government should not be criticised for their underfunded, inadequate COVID-19 response, because other jurisdictions actually have it worse. Yet there are neighbourhoods in Brampton that have a COVID-19 positivity rate of nearly 20%. One doctor describes this, and I'll quote, staggering number that suggests that there is a huge problem, end quote. There are now 165 patients in the ICU. That is 1 out of every 10 ICU beds in this province. When is the Premier going to stop justifying his inaction and start supporting people living in these hard-hit communities and the hospitals that serve them?
The Deputy Premier and Minister of Health.
Well, in fact, we are supporting Peel and the entire area since they have, unfortunately, needed to go into lockdown, as with the City of Toronto. We recognize that they need additional supports in order to deal with the rapidly increasing number of cases that they're seeing. What we have done is sent more case and contact managers into the area to assist with helping to identify people who have COVID-19 and their contacts. We're also expanding the hospital facilities for people that need to be in the hospital, and we're making sure that we have received help from some of the other public health units that don't have as high a number of cases in order to help by telephone support with case and contact management. So we recognize that Peel is going through a very difficult time. We want to help Peel get out of the lockdown as soon as possible, and we are providing necessary resources in order to help Peel to get there.
The supplementary question.
Speaker, every day the Ford government downplays the impact of this pandemic. Peel Public Health data shows that essential workers on the front lines in manufacturing, transportation and healthcare have been exponentially more likely to be infected. They are not doing well, as the Premier likes to pretend. These people are facing a crisis, and facing it without help from this government. When will this government stop trying to protect itself and its bottom line and start taking real action to protect and support the people in this province who need it most?
Minister of Health.
Well, just to indicate the support that we are providing to Peel, we have established 3 new community-based testing centres. We have implemented mobile testing sites. We are opening limited walk-in availability at assessment centres for those people who are not able to either book online or make telephone appointments. And we are implementing up to 7 pharmacies or specimen collection centres in the next several weeks. We also have invested $42 million for up to 234 new beds at 3 hospitals, including alternate health facilities in Peel region, to support hospital capacity pressures and the continuation of surgeries and procedures. So we are providing both health supports in terms of hospital beds and supports as well as contact managing, testing and tracing.
Commentary.
Speaker, and through you to the Minister, but help in a few weeks is not going to help us today. Working people in these communities hit hardest by COVID-19 don't need the Premier to continue to tell them that the pandemic could be worse. They need this government to actually step up with dedicated resources for testing and contact tracing through this pandemic, culturally specific COVID-19 outreach, urgent and direct support for small businesses, and direct support for those people who work with them. Start with a guarantee that they can leave work when sick without losing a day's pay. When will we see any of this?